Everybody, thanks so much for listening to Fire Breathing Rob. If you're listening to us on YouTube, please subscribe, like, and share. If you're listening to us on the podcast, also please subscribe, like, and share. And if you're listening to us on one of the radio stations, I appreciate that. And thank you so much for doing that. Please keep getting the word around us as far as the show goes on the other platforms too. This is Ellen O'Donnell. She is a PhD, and like I said, she works at Harvard. So Ellen, first of all, thanks so much for spending some time with us today. It's appreciated.
Yeah, thanks for inviting me.
All right, so let's kick this around. So just to start off the interview, what made you want to go into this field? Because it's such a tough field. As a person that, knows a lot of therapists personally, as friends, they tell me, that they have some very stressful days sometimes. So how did you get into this field, and what made you want to get into it in general?
Sure. Yeah. I mean, I always knew I wanted to work with kids, not quite exactly sure why, just that sort of, you have that instinct or calling of something that you would enjoy and be good at. And I actually went to college, started pre-med, thinking that I would be a pediatrician. And I hated all of the classes that I was taking and was really bored and trying to memorize everything. And so I went to meet with a dean. I went to Boston College undergraduate and talked with her, and she asked me why I wanted to be a pediatrician. And I actually talked about my anatomy physiology teacher from our alma mater, LaSalle. I had Mrs. Starkey. I'm probably dating myself, a long, long time ago. And what I'd been most interested in was the link between the brain and behavior. And I remember her teaching us the anatomy of the foot by talking about Chinese foot binding and all these kind of cultural influences. So I told the dean, I'm just really fascinated on the connection between the mind and the body and how our health is shaped by our environment. And she said, and have you ever taken a psychology class? And I had not. So she got me into my first psychology class, and I kind of fell in love with it. So I became a child clinical psychologist, went to graduate school for that. And then I did my internship and fellowship at Mass General Hospital, where I'm still now a pediatric psychologist, and kind of brought back in that interest in medicine because I work mostly with kids who have medical illness. So I work in the endocrinology and diabetes center, and I work at Shriners Burn Hospital through their affiliation with MGH. So I kind of brought those things together in the end.
With the mental health crisis going on in our country, is it just starting because of COVID, or is this a crisis that's just really exasperated, really blown up throughout COVID, and it was already there before?
Yeah, I think it's probably more the latter, that it was exacerbated by COVID. And maybe it's a little overly optimistic, but I like to think that it's probably a combination both of actual increasing mental health concerns just based on increasing stress and pressure, and exacerbated by the isolation of the pandemic and the anxiety, but also things like anxiety around climate change and racial injustice. And, the sharpest rises, at least in mental health concerns and depression and anxiety in youth, are among minority youth and youth of color. So I think that a lot of things have been building. My more optimistic side wants to think that maybe the rates are also going up just because there's less mental health stigma, and we're more willing to acknowledge when people are struggling and call it out. And so maybe the rates of diagnosis are going up in part for a good reason. But I think it's probably a combination of things.
Do you see a lot of kids that are struggling right now? Because, I'm Italian, so we have a lot of that tough love.
Don't let the last name fool you.
Yeah, right. Okay, so you know the story. You grow up, you have this, tough love, this hard grit, go out there and pull yourself up by your bootstraps for mostly as far as that culture, but it's a lot of different cultures. And I see this a lot with men too, and even boys in general when they're growing up, that they don't really explain their emotions. Rather, they're basically emotionally clueless. And then they keep going down the line with the cluelessness. And then eventually something, because they're holding it in inside for so long, it erupts, and they do something either crazy to themselves, to somebody else, or they just suffer by themselves. Are you seeing that a lot with younger kids in general? Especially boys, I guess.
Yeah, I mean, I think you're right. I think boys get a lot of those messages that they need to be confident and assured of themselves and know, what they want when they want it, and sort of squash some of those feelings of uncertainty. I think and girls are, of course, getting their whole set of very gendered messages. I hope it's starting to break down a little bit. And that I think for a little while, what I saw more was a swing of the pendulum from really kind of authoritarian, stricter parenting to, then we saw the stuff in the media about how parents are coddling their kids and now we're being too permissive and we're not kind of expecting enough of them. And,
Mhm.
you know, all the research tells us that it's more in the middle, that to give our kids choices and the ability to kind of feel the full range of emotions and human experience, but also letting them make mistakes and learn from their mistakes and make their own decisions and learn how to apologize and how to fix the mistakes that they make is just as important as giving them structure and rules and guidance and expectations. So I hope we're kind of finding more of a middle ground, and maybe also allowing more of a middle ground for boys and girls and everybody in between to kind of be who they are, feel the feelings that they have, and share them, like you said, and reduce some of that stigma.
Right. Ellen O'Donnell here on Fire Breathing Rob. Ellen, as we move into this, I want to get back into the coronavirus aspect of this. So, I sent you that statistic before we went online by the NHS over in England. Their health service came out and said 1 in 6 children have a mental health disorder between the ages of 5 and 16. Uh, and I know you said you think this is more toward the coronavirus aspect, and you can correct me if I'm stating your thesis wrong as far as that goes. But my question is regardless if it's toward the coronavirus, if these kids are getting on medications, which I just want to say some medications are good. I wouldn't want somebody to be on medication for a long, significant period of time unless they really need it, because obviously there's addictions, and you can go more into that in general. Right now, with all these kids having these mental health illnesses, are you worried about the addictions with medications, or being pumped with just all these antidepressants, anti-anxiety
Mm.
pills?
Really good question. So I mean, yeah, there's a reason I'm a psychologist and not a psychiatrist, so I don't prescribe. But I do think that medication can be another really useful tool in the toolbox for anxiety, depression, ADHD. And I think it really depends on what we're medicating for too. So there's actually some really good research that suggests, for example, for kids with ADHD, if they really would benefit from a stimulant medication and we don't put them on it, they're actually at increased risk for addiction later on, because they'll
Mm,
find other ways to sort of self-medicate for the problems that they're having. And so we need to be really thoughtful about that as well. So I think that the medications can be another tool in the toolbox, but I don't think
right.
they should be the first line of defense. And, I might even say, I always say it's important to consider therapy and
Mhm.
getting other skills and tools, because obviously that's what I do. But I really think if we're really going to really, really, truly address this mental health crisis, we have to be thinking before therapy, before medications. Because, even in places like I live in Massachusetts, where we have what's considered a lot of mental health care providers,
Right.
even in a place like where I live, there's almost 40% of kids who have depression are not getting any mental health care. In places where we don't have access, then it's closer to 60% of kids who are not getting the mental health care they need. So I actually think we really need to be thinking ahead of that, to prevention, to really building kind of, we're hearing a lot about resilience. It's kind of the psychology trend of the moment, I guess, to help build our kids' resilience. And I think that is really important. But I also think that as communities, we need to start addressing some of the pressures and stresses that are contributing to the mental health crisis in the first place. So,
Mhm.
I think one very interesting thing that we saw last spring when things started to kind of open up again and kids went back to school in person, we were seeing more kids coming to the psychiatric emergency room.
Oh,
And
wow.
it was because they were going back to the pace and the pressures that many of them had been relieved of in the pandemic. The pressure to take the SATs, get caught up, make up for all this missed time and missed work, and apply to college and do all these things. And so we were seeing an impact of that in increasing anxiety and depression and hospitalizations just when ostensibly things were supposed to be getting back to normal and getting better. So I think we also have to really now look hard as we get back to what I hope could maybe be a new normal and things be a little different than before, and think about the pressures we're putting on our kids in our families and our communities, to do a better job of preventing them from having a mental health crisis in the first place.
What mental health issues are you seeing as far as on the rise, like conditions? Is it just
Mentioned there was definitely an uptick in eating disorders during the
okay?
pandemic. That was another one. But one of the things I've been saying to a lot of people about depression is we were basically asking people at the height of the pandemic to act as though they're depressed, and teenagers especially, right? I mean, to stay home,
Oh,
limit
yeah.
your social interactions. Sleep patterns were disrupted, eating patterns were disrupted. We weren't getting outside time. Many kids weren't getting the same physical activity and exercise that they needed. And so, there's this very old research in psychology that had people make different facial expressions, and then found if you make the expression long enough, you'll start to experience that emotion. And so if we ask people to act like they're depressed for long enough, they're going to start to feel depressed. So I think even people who weren't vulnerable to depression before the pandemic, we made them, many of them, vulnerable to it. And then anxiety, definitely. I think, anxiety comes from a feeling of not being in control and being afraid and feeling like you can't kind of control your world and the outcomes around you. And we had a lot of reasons to be afraid for quite some time. And in some ways we still do. And I think that's where climate anxiety and
Yeah.
other things contribute too.
So to go into the last few questions, because I do want to get into a couple audience questions of people that left some. But let's get into that. So if a parent is seeing a kid act different, what would you suggest them to do? Would you suggest them to, maybe they've talked to the kid before and, because kids, like adults, can put on a fake happy face and
Mm,
go through the motions, and we may think everything's all right. And then all of a sudden, one day something may trigger somebody, and that could be game, set, match, unfortunately. So what would you tell parents as far as, if they see something, what should they do as far as their kid goes?
yeah. A former supervisor of mine always had a pretty good rule of thumb. I think that you really maybe want to start thinking about kind of recruiting some more professional help if you see your child struggling in more than one area. So not just when they're home, but not just that they're kind of retreating to their room and pulling away from family, but if they're also not wanting to spend as much time with friends, and so it's impacting them with their friends, or they're behaving differently in their schoolwork or at school. So kind of looking for those signs. And I
Mhm.
think, you sort of alluded to this already, but just kind of commenting to our kids on what I kind of like to give key phrases just to say, I've noticed that, right? So what have you
Yeah.
observed? And just to kind of say to them, I've noticed that you haven't been going out with your friends on the weekends as much as you used to. And I'm wondering if that's just because you don't want to, or something happened with them, or something's going on. So I think when we start with I've noticed and I'm wondering, it kind of gives them room to um, correct us if we're wrong and open up if we're right, without sort of putting it on them. Do you need to see a therapist? Do you want to go see a therapist?
Right.
Um, and then if it is at that point where you feel like you need extra support, to talk to
Mhm.
their pediatrician, to talk to their school counselor, and maybe kind of get another adult's perspective too on what might be going on.
But my thing is that if you have kids, they usually mimic your actions. So if you're paranoid about the coronavirus, they're going to be paranoid about the coronavirus. If you're not, and you think masks are a joke and the vaccine is a joke, they're going to think it's that way, or they're going to mimic their friends. So if like, for instance, I'm a news junkie, I got my vaccine, I wear my mask, sometimes I wear two. People think I'm a little paranoid, but it is what it is. But if I had kids and they were mimicking what I was doing, maybe they would have severe anxiety. Maybe they would have that agoraphobia to go out into the world and be freaked out and nervous for the first time after being inside for such a long time. So would you agree with that, though, the parents? And how does a parent that, I guess, believes in science, that agrees that this is correct and this is real life and this is really could kill you? How would you tell them to talk to the kids about this, or even act? Because you don't want to freak the kid out too much, because like I said, it could lead to severe percussions rather down the road.
Yeah, no, you're definitely right. They're definitely watching us, and they're going to do as we do, not as we say, right?
Yeah, you're
Yeah, no, definitely. I think I've been talking a lot about risk analysis and sort of modeling that for our kids and having those discussions. So, and one way to think about it too with kids is to kind of think of, you have like a risk budget. So at the height of coronavirus, I have a 17-year-old, and we would talk about this, that he kind of had a risk budget. And so if he was going to choose to, he really wanted to spend time with certain friends in a certain setting, we could mitigate his risk by having him wear a mask, etc. But also, if you're going to spend a little bit of your risk doing that, then maybe you're not also going to, on the same weekend, hang out with a different group of friends, because now you've spent, $5 instead of $2 of your risk budget. So that we kind of have to discern how we take risks every day, right? We take risks when we cross the street, when we get in a car, when we get on a plane, you name it, we take risks. And every time we take a risk, we usually do it because we know we believe that the benefit is going to outweigh the risk. And so I think that's one way to really talk about it with kids too, is, when maybe I, as a parent, am making this decision that we're going to wear 2 masks on the plane because the benefit of not getting sick and of being able to go where we want to go, for me, way outweighs the risk. So we're not doing this because we're terrified or we're scared. We're doing this because we're being brave and we're being smart. And so I think a lot of it is in the ways that we talk about it with them, and sort of explain how we've come to the decisions that we've come to. And they can make their own decisions. They might disagree with us. There was a great article up here years ago about how there was this trend among 9-year-old boys in Boston to become Yankees fans. And outrage their Red Sox fan parents, and the psychology behind that, like that if you push it too hard, they're going to go in the other direction. So I think, we have some experience with this in less scary venues too.
So I want to end with these last audience questions. So we've heard a lot about this in the news, and I know this gets into kind of political as far as that goes, but as far as the anxiety that, if you're talking with the kid, and I know the vaccine is only, I think it's 12 and up, you may be able to correct. Okay, 12 and up. Okay. So if they're 12 and up and you're dealing with this kid, and let's say, the kids are 12, they know how to use technology, and they know how to research the vaccines. I'm sure they can find conspiracy theories about the vaccine and stuff. And the kid says, hey, or maybe the parents are freaked out too about the vaccine in general. How would you talk to the kid about that? Is because they may be having some severe anxiety, or the parent may be having severe anxiety about this shot.
Yeah. I mean, I think, I'm definitely on the same side as you, in being pro-vaccine. So of course there's that bias. But I think, one of the things we try to do, especially, I'm in kind of an integrated medical clinic where patients come in and see the nurse and the doctor and me and everybody kind of together. And so I think a lot of it is just taking that wondering stance, like, I wonder what it is about the vaccine that you're concerned about, because to your point, they might just have some misinformation that we can correct. So instead of kind of jumping in and trying to convince them, trying to find out where they're coming from and what they're worried about, and does it have any basis in fact or science? And if it does have some basis, if they say, well, it's still relatively new, we don't know that much about it, and we can explain that we actually know more than maybe they think we know about it, but to also say, yeah, there may be some risk, or a lot of the kids I find are most scared of side effects. And so we can belittle that, or we can acknowledge it that, yeah, I know, that could really stink if you have those side effects. But from where my perspective, the risk of having side effects outweighs the benefit of not getting COVID and not, spreading it. And at least up here where I am, I mean, it's been really interesting. I mentioned my 17-year-old. I mean, as soon as he could get it, he came to us and was like, put me on, get me an appointment.
Wow.
And I think it was obviously we're pro-vaccine, so he was hearing that, but I think he knew this was the way for them to
move forward,
get back to some kind of normal and to move forward. I mean, he missed a huge chunk of his high school experience, being able to be in cars with friends and go to concerts and be together in groups and be in the classroom. And I think he knew this was the fastest way back to that, and seeing his grandparents. And, so I think sometimes we also have to trust them, maybe when they're a little bit more brave than we are, or want to do things a little differently.
No, I hear you. And I mean, there's side effects after you get the shot, and some people have it more severe than others. You heard any kids that are worried about, Zoom school, the stress of that? Obviously they're not seeing their friends, their teachers who they might have good relationships with. And we also think about the mask. There's kids that come from families that are against the mask. There's kids that come from families that are significantly for the mask and wearing it. So how has that changed a lot of kids' attitudes? Because honestly, between us and the people listening, this isn't going to end anytime soon. Let's be real.
I know. I don't know if this is exactly answering the question, but I think that the frustration for me, and I think you're getting at this, is that we really put kids or students in the middle of this political fight, that they become pawns in this back and forth. And instead of us really putting their needs first. So, I kind of saw this in the sort of opposite sense up here in liberal East Coast New England, when Trump came out and said the kids have to be back in school, like, we got to open up schools, get them back to school. And then kind of liberal progressive parents like pulled back, no, they can't go back to school. And I'm fortunate to live in a school district that I think actually did a pretty good job of weighing and mitigating the risks. And so my kids were on a hybrid schedule all last year. So they were in school some of the time and remote some of the time, and they were wearing masks and they were doing testing in school. And so, with the goal of having them in the classroom as much as possible while keeping them as safe as possible. And I think for most kids, that should be the goal, because I think most kids do better with in-person learning than they do on Zoom school.
Right.
There are always going to be exceptions to the rule. I have some patients with anxiety or autism spectrum disorder who actually kind of thrived with remote school. And so now their families finding ways to continue that. And I hope that continues to be an option for the kids who benefit from it. So there is no one size fits all, but, public education at least is meant to address the needs of most kids, of kind of your average kid or the greatest number of kids. And I think most kids need to be physically in school as much as possible while we try and mitigate the risk of them getting sick or perpetuating the pandemic.
There's been a lot of talk about how masks affect kids' mental health. Do you believe in that? Is that just kind of a BS theory in plain English, or is that really legit?
That is not, well, let me put it, how shall I answer this question? So we're too close to it to have a whole lot of data, right? I don't know that anybody's gone out and done a really good study. And I don't know how you would do that anyway. What do you do? Say, we're going to randomly assign this group of kids to wear masks all day and this group of kids not in a global pandemic? We can't do that. We don't really have a whole lot of data on it. But here is one thing I will tell you. I've been practicing throughout this pandemic. So we've just moved to all telehealth. I've been seeing all of my patients on Zoom. I've seen more patients in the pandemic than I was seeing before the pandemic. I see kids from ages 2 to 22. Wow. I have not had a single patient in the past 2 years come in concerned about having to wear a mask. That has not been their concern. And, you know, I think when we have been able to get kids back in environments where we know they thrive, whether it's school or sports or dance classes or whatever, any annoyance over having to wear the mask is outweighed by the benefit of being back in a place that they love to be and where they thrive, and knowing that their chances of getting sick are lower. So I'm not quite sure what, I don't know, I haven't heard a whole lot of the arguments for what specifically is damaging to kids about wearing masks, but at least from personal experience, I can tell you I've not had a single complaint to that effect in almost 2 years of practicing in a pandemic.
We always end the interview with a little bit of hope. So can you end this interview for parents and kids in general with a little bit of hope about this pandemic, about mental health issues in general?
Yeah, so I actually was running I traveled for the first time since February of 2020 this past weekend, and went to, it was a progressive Christian music and author festival that I went to with my book co-author, and we ran some small group conversations at this conference, and we asked parents to sort of brainstorm things that they wanted to leave behind in a post-pandemic world, or, you know, as we move into what seems like more of an endemic than a pandemic, and things that they wanted to take with them. And, you know, the list of things that they wanted to keep and take with them, things like, you know, breakfast at home together, permission to say no, you know, to make our schedules less hectic and crazy, to skip a practice or play one sport instead of 3, or, you know, weekly Zooms with grandparents. There's one where the grandparents have been Zooming every night to read stories to their kids to go to bed, and they want to keep doing that. So I think the hopefulness is if we can really keep that idea of moving into a new normal and not just getting back to normal, because there were a lot of things for parents and kids and families about normal that weren't working. And I think if we can really kind of commit to this as this time of transition, as a time to kind of reassess and reevaluate and figure out what we want to take with us and what we want to leave behind, then we can really let this very difficult time maybe have some positive transformation for our families too.
Great advice, and I appreciate that. Again, Ellen O'Donnell. And Ellen, as we end, can you tell people where they can find more about you and even get the book?
Yeah, sure. More about me and the book is at blessthismessparenting.com. And then you can find me on Twitter at Ph.D. Ellen, and the book and other things are on Instagram at blessthismessparenting also.
All right. Thanks so much, Ellen. I appreciate your time today.
Thanks for having me.